Good afternoon, everybody. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department, coming to you from our North Bayou, downtown Keeler location with today's update on the effect of the COVID-19 pandemic on Mobile County residents. I mentioned yesterday that worldwide we've gone over the 10 million mark with confirmed and probable cases of COVID-19, with greater than 500,000 deaths worldwide. In the United States, we're sitting around 2.6 million cases of COVID disease with over 125,000 deaths. And in Alabama today, reporting 37,536 confirmed cases with 926 deaths. In Mobile County residents, the news went from bad yesterday to worse today, I am afraid to say. So today we're reporting 3,661 COVID-19 patients. When the backlog of results from a mishap at the in Montgomery on Saturday got corrected, our number from Sunday went to 102 reported on Sunday, and yesterday 118 cases were reported. So in the last 7 days, we have had 4 days with the number of reported cases over 100. Those are the 3 highest number of cases reported in any one day since we began talking about the COVID-19 outbreak in Mobile County, with our first case diagnosed or reported to us on March 19th. We have 297 hospitalized, 136 have died. Luckily, those numbers right now don't appear to be rising as quickly as the case count, but again, these are what we call lag indicators, that there is generally anywhere from 1 to 7 days that it will take once someone becomes sick. Most people, if they become sick enough to be hospitalized, it will happen within 7 days. So it will be next week sometime before we really start to see the effect of this rise in the number of cases on hospitalizations and deaths. And with the holiday on, many of the offices closed in observance of 4th of July on Friday, and then many places closed on Saturday, July 4th, including the state public health lab will not be processing specimens on Friday or Saturday. It may be early into next week before we realize the effect of this rapid accelerated phase of transmission that we're experiencing in Mobile County. And again, most of this is driven by 18 to 40-year-olds who will have, luckily, have mild illness, but if they are not wearing face coverings and if they are out in public, they may unknowingly be transmitting COVID to people who are vulnerable to severe complications and death. And this is why we keep encouraging and strongly recommending the use of a face covering when you're out and about, not to protect you, but to protect those most vulnerable in our community. We all have a part to play in protecting our most vulnerable community members and citizens. So I'm not going to talk too much more about data today. I do want to point out that a couple of things happened today at 10 o'clock. Today, the governor and the state health officer announced an amended Safer at Home order. So it was amended today, June 30th. And with very minor changes, the Safer at Home order has been extended through 5 p.m. on July 31st. So many of the Safer at Home orders have been extended. Just a quick read, the only things that I noticed that had changed really had to do with visitation in hospitals and similar institutions. So prior to the updated, so this will be effective July 3rd. That was the date the current order expires is July 3rd. So on July 3rd, all hospital and nursing home long-term care facilities, including assisted living and specialty care assisted living facilities, shall limit the entrance of visitors. The previous order said shall prohibit the entrance of visitors as defined by the facility and not essential healthcare personnel. except for certain compassionate care situations such as maternity, end of life, and support for persons with disabilities. And also they've added, as well as any other situations where the presence of a caregiver would facilitate appropriate care. So again, the prohibition on the entrance of visitors has been modified to shall limit the entrance of visitors, and that goes into effect July 3rd. So again, basically the extension of the current Safer at Home order through July 31st with very minor modification, and I'm sure if there are other things that have changed, someone will bring that to my attention and I'll talk about it tomorrow or Thursday. All right, let's get to a couple of questions. There were a few things that I didn't get around to answering yesterday. Let's see. One question was about extending the Safer at Home order. I think, the governor and state health officer answered that question today, that the order will be extended through July 31st with very minor modifications. Certainly, it's not the time to be lifting restrictions when the County of Mobile and the state of Alabama is seeing an unprecedented number of cases reported. So just, a widespread community transmission, really accelerated phase of transmission that we're in now. Still lots of questions about wearing a face covering and not wearing a face covering and who should and who shouldn't. So there are plenty of shalls in the order. Plenty of workers who in the health order are told that they shall wear a face covering. So please read the order carefully to see if it applies to you. It applies to daycare workers. It applies to, frontline workers at restaurants and bars. It applies to close contact businesses like hair salons, nail salons, tattoo parlors. So again, don't just base your decision on what your friend told you or what you heard on the news. Read the health order so that you can know which sections of the health order apply to you, and then you can implement those in your facility. It's not hard to wear a face covering. Just takes a little getting used to. And all over town, people are doing it, and nobody feels odd about it anymore. No one thinks that if you come in with a bandana around your nose and mouth that you're there to rob the bank. Everyone is just becoming sort of part of our life. So please wear your face covering while you're out and about. Someone was asking me about maybe a fair or carnival that was going to be set up in the parking lot of a shopping center. What are recommendations to the public for attending? It's the same recommendation for any gathering. It's prohibited unless you can maintain a 6-foot distance between people who are not from the same household. It doesn't matter if it's a fair or a drive-in movie or the beach or picking up food curbside. If there is a gathering of people, whether it's 50, 500, or 5,000, they're prohibited unless you can support 6-foot physical distancing among groups that are not household contacts. So the different examples keep coming, and I keep saying the same thing. It's not allowed unless you can support the 6-foot physical distancing. And again, we would recommend wearing a face covering, staying at home if you're sick, washing your hands, or using hand sanitizer if there are no restrooms. Someone sort of asked about something a little bit off subject related to infectious diseases, but not COVID, asking about public restrooms that don't have closed toilet lids, and the fear of pathogens being dispersed during flushing. Could a closed lid help stop transmission? And yes, it could, but this is something that we have dealt with before. There's not a lot of disease transmission that happens because toilets are being flushed, but if you do a study and go swabbing around, yes, you can find pathogens, or mostly bacteria, that could make people sick in those spaces. Water fountains, drains, toilets, toothbrushes, they're notoriously packed with all kinds of pathogens. And again, most of the time people are not at risk of serious disease, but there is some related to transmission of fecal matter. All right, here is a question we've gotten.
Oop, hang on.
Hold on a second.
No, we've lost our.
It's okay.
Let me see.
The red light's still on.
I know, but I got a warning here and we're dead there.
Okay. We can just stop for today.
Okay. Let's see. Okay, we're back.
Okay. Ready? Sorry, everyone.
Yes.
This
Yes.
happens. We're a health department, not a news studio, so thank you, Mark, for figuring that out. So I just wanted to answer a couple of questions. We have heard throughout the outbreak concern from planners of, what's it called? The Mardi Gras societies.
Mystic societies.
Mystic societies, who have commented that, you know, it's really difficult to plan for events, for things like football seasons, for Mardi Gras season, for when do you open your business. We realize that there are lots of planning, you know, watermelon festivals are canceled, fireworks are canceled. We understand that, you know, COVID has placed a burden on lots of different kinds of businesses and schools and agencies and, you know, societies. And so we don't have any special rules for mystic societies that are looking for some insights on planning. But again, under the current order that is set, has been extended through July 31st, no gatherings unless you can maintain a 6-foot physical distance. Someone from the media asking if we can release daily data showing how many COVID patients are in Mobile County hospitals. I usually mention that it's around 55 or around 64 or something like that. It's not data that Mobile County Health Department is authorized to release. That information system is run by the state health department, and those data are reported to our federal partners. There are some websites out there that are reporting that data, but Mobile County Health Department is not authorized to release it. I know the state does show that data for statewide, so if the state decides to provide more granular data on that, then we'll let you know about that. Let's see, a couple of questions that were resubmitted for yesterday about, you know, should people who have had COVID but have recovered, should they still wear a mask? Yes, it's a good idea to do so. I think we just need to get into the habit of wearing a mask to protect others until we're way past our COVID outbreak, or until we have a vaccine that can protect us, or until we have a treatment that can keep people from getting ill. So, you know, there is a lot of strong feelings on both sides of this coin. Some people who are vulnerable to severe complication are really angered that younger, healthy people are not wearing masks when they go out in public, because, you know, the people who need to protect their health feel like that they're just held hostage in their house, because when they go out, not enough people are wearing masks. So then on the other side of the house, people feel like, you know, we're trying to violate their civil liberties or restrict their rights as citizens in some way, and we're certainly not doing that. We're just asking everyone to recognize their contribution to community spread and potentially, you know, infecting someone unknowingly. I don't think anybody would want to deal with the guilt of that happening to them. So that's why we're just encouraging everyone to wear a mask. The virus is real, it is not fake. Wearing a face covering helps. To what degree does it help? We're not quite sure. but we know that it is an added barrier that can help slow the spread of transmission. What's my opinion on the governor's Safer at Home extension? I think it was the right thing to do. We are in the throes of the most transmission we have ever seen since March is going on right now. I cannot emphasize that enough. You know, we had much lower cases, much lower case counts, much less transmission when we were under more stringent restrictions. I think for me, as an epidemiologist and a scientist, I'm keeping a very close eye on the number of hospitalizations and deaths, because I believe if it's rising only in those that are healthy and can survive with the illness with just having mild symptoms, you know, it's okay if we have transmission in those healthiest individuals, because they will help us work toward, you know, that herd immunity that we were talking about yesterday while we're waiting on a vaccine. But if those people are not protecting our most vulnerable citizens by wearing a mask when they're out in public, then I will expect that we may see some strengthening of the restrictions. But I think that what the governor and state health officer announced today is the right thing to do for now. Let's see. Someone's asking about the city council's decision about face coverings. I don't believe a decision was made on that today. I think they're going to talk again about it tomorrow. A report of one of the downtown bars closing due to COVID. Yeah, and you know, several reports of several bars and restaurants not following the guidelines of the Safer at Home order. Yeah, we had been hearing about this anecdotally. We have seen it ourselves when we're out in the community picking up meals or picking up groceries. People have posted on Facebook, hey, this is why, you know, Restaurant X had to close down because I was in there 2 days ago and this is what it looked like at their bar. So this is what happens if you don't follow the Safer at Home order and you don't really think about reducing spread in your facility. You're going to get people, you know, find out that workers or patrons have COVID, and you're gonna have to, you know, shut the place down for disinfection for a day and under some circumstances. So yes, it is happening, and we began accepting complaints at our iscomplaints@mchd.org email address last Thursday, and since then have gotten dozens of complaints every day. So we know it's happening. We've also been consulting with daycares, with congregate residential settings, with businesses, with government agency offices who have had, you know, COVID positive workers or staff or customers that are very concerned. And so all of this is because the restrictions were lifted and people started going about daily life. And we have to do that. We can't shut down our economy forever. But we also have to remember that it's not just, you know, a free-for-all for everyone. We have to balance, you know, infection control, slowing the spread of transmission so that we don't overwhelm our hospitals with our need to be able to socialize and shop and retail and dine out. Okay. So someone asking, I think, what is considered a fever in a child. It's 100.4, that's how we define fever. What is the time frame you should remain home before returning to daycare if you have a fever? If you have a fever and then you need to stay at home until you've been fever-free for at least 3 days, and it's been 7 days since your first symptom onset. That's a little tricky sometimes, so if you have questions about it, please give us a call or contact your healthcare provider and we'll try to walk you through that. What about people that live with someone who is positive, test negative, and then develop symptoms and don't get retested? Those cases aren't counted in these numbers, and I know so if you have a positive test, you are counted. If you have a positive PCR test, you are counted, whether you have symptoms or not. So don't worry about that. It will count you. If you had exposure to someone who was positive and you tested negative, it could be that you were tested too soon. It could have been a false negative, because generally you need to have virus circulating for several days. We're saying 5 to 7 days before you should get tested. But yes, those tests do count. And let me reiterate something that I said yesterday that I keep getting asked about. If one person is tested positive 1 time, or positive 2 times, or positive 5 times, or positive 10 times, that counts as 1 COVID positive. That is not what's driving the numbers up. Right, so we get the lab results, and then we match, all of the results on one patient using name, date of birth, and then we combine all of those test results into one investigation. Okay, just want to make sure I'm clear about that. Let's see. So while we're covering our mouths and noses, and I certainly am, thank you for that. What about other accessible openings like eyes and ears? Certainly, eyes are concerning. That is a potential pathway for infection. So if you would like to protect yourself even further, please wear eyeglasses or goggles or a face shield. But again, the reason for wearing a mask is not to protect you, right? It's so that your droplets don't go out. But if you are concerned about potential transmission through eyes, then certainly throw on a pair of glasses or goggles or a face shield. And then there's a question about ears, and I don't think there have been any examples of COVID transmission into someone's ears, but we do know that this can happen with other, children get, ear infections, and so sometimes that can come from swimming or other things. So we know that the ears can be a pathway for transmission, but I've not seen where there has been COVID-19 transmission through the ears. And then the last one here is, why is it that the big box stores and home improvement stores are allowed to remain open when at any time they seem to be business as usual? So there are restrictions on the number of shoppers that they can have, but yes, this is a concern. We see this as well, that there are a lot of people in the big box stores and the home improvement stores, and again, we're beginning to follow up on your complaints about these, just to call them to make sure that they are aware of what the Safer at Home order says, and provide to consult with them about some best practices. So if you have a complaint, or if you've observed in the community, a business or an agency that is not following the Safer at Home order, then let us know and we will reach out to them. So unless there are things on Facebook today, I'm seeing that there aren't any burning questions that we have to answer today. So I think, I'm not sure if I will be here tomorrow, or it might be one of my colleagues, but we'll give you the update tomorrow, because there's going to be no press conference, right? No Unified Command press conference. Okay, everybody's doing this. They don't know. So if there is a Unified Command press conference tomorrow, that will take precedent over our Facebook Live update. But if there is no Unified Command press conference, then someone will be here tomorrow to give you the update of our COVID outbreak and to answer some of your questions. So we'll see you again tomorrow.